So good morning all.
Good morning.
Greetings to all after completion of 21 marathon materia medica series. We will be starting today with Repertory series, and I am glad to all of you. You are here to learn the Repertory in a very fun loving way. So we are not wasting time, just starting with the process. So we always remember our masters, tribute to Master Samuel Hahnemann, who taught us dare to be wise. So you are here, that means you have a dare to learn, and that is the reason that you are here. Secondly, I will take blessings from my guru, Dr. Praful Vijayakar sir, who taught homeopathy is mathematics. So everything is in a mathematical calculations. Thirdly, my biggest inspiration in the field of homeopathy, because of this person, Dr. Jitesh Sosalia, I am here and I am giving you bits or pieces of the knowledge share with you, because this man has given me wonderful knowledge and inspiration in the field of homeopathy. Last but not least, my mentor, my guide, my best friend forever, Dr. Suketu Shastri. Because of these people, this man behind my development, I am here on the stage. So I am taking blessings and thank you all to my mentors, my guide, my teacher, my gurus, and even the Master Samuel Hahnemann, who gave me this path to share with you all of. So let's start Repertory. So Repertory, now to understand Repertory, what was the need of Repertory? Why we need to learn Repertory? Already we have learned everything, materia medica, organon and everything. Why we need to learn Repertory? What was the need?
We cannot remember all the symptoms of materia.
Okay, it's a human mind limitations, cannot remember all symptoms. Anything else?
Easy differentiation.
Easy differentiation. Okay, anything else? Why? See, if we have to learn something, if we don't know why of that thing, then we have no clarity of mind. If we know why of the learning, then we have the clarity of mind. You know? So that is why we need to learn Repertory. Tell me. Yes, tell me.
આપણું શોર્ટકટ થઈ જાય કામ.
Okay, one thing is time saving, shortcut. Anything else? Gradation of medicine we can learn. Very good. Anything else?
Case taking improve.
Yes, we can improve case taking through learning the Repertory. Very important. How?
સિમ્પટમ્સ નું ક્લેરિફિકેશન આપણે સારી રીતે કરી શકીએ. કેટલું વધારે ઇમ્પોર્ટન્સ આપવું.
Okay, so evaluation of the symptoms according to Repertory. Yes, anything? Okay, so by understanding sub-rubric we can ask certain question to the patients. Okay, anything else?
Improve our knowledge of materia medica.
Obviously knowledge has to be improved. Fine. Anything else? See, when we learn, why we need to understand Repertory, because when we learn materia medica, we have a certain image of a certain remedies. Say for example, I will ask you one question. Tell me the pulsatilla. What is pulsatilla? Tell me. Changeable, gentle, consolation emulations, open emulations, yellow discharge, bland discharge, alternating discharge. Then, so we have a certain fixed picture of pulsatilla in our mindset. When we get this type of patient in our clinic, then we can prescribe pulsatilla. Am I right?
Yes.
If we get a person who is very bold, courageous, business-minded woman, can you prescribe pulsatilla? No. Why?
Psychosis-માં હોય તો
Exactly. So the repertory teaches you a trimathematic picture of the medicine, and that is why the need of repertory. So you have to understand dispositions. If this dispositions matches in the soric stage, if this means disposition matches in the psychotic stage, and this goes into syphilitic stage. So this is very important aspect of understanding. You know, pulsatilla male. Do you understand what was the pulsatilla male?
ambitious.
Very ambitious, business minded, courageous, and when they goes into syphilitic state, what was that state? They become effeminate. You know, so this is something that the male become feminine. So if we don't know repertory, we cannot prescribe pulsatilla to effeminate male. You know, the same way lycopodium is also effeminate. When we see lycopodium is very haughty, soft with superior, high with inferior, dominating, dictatorial, and it goes into syphilis, it's effeminate. So we cannot understand that lycopodium is like this or this. But when we read repertory, when we have a clarity, then we can understand this is the syphilitic aspect of lycopodium. So that is the need of understanding repertory. It is not just a simple understanding of the rubrics, and according to that rubrics we can understand or we can ask certain questions. It is okay, fine, it will help you in case taking, you are right. But you have to understand the dispositional part through the repertory. And that is what my aim to share with you this series, that how repertory can be useful in dispositions of the patients and understanding that things. And that is the reason we are starting with this series. So this is today's lecture is just a little bit theoretical, and after that I will share with you few cases and a few rubrics, and then we go to the cross reference and understanding. So starting with the introductions, sir always says, I do not see what mind does not know. So if we have a patient in front of us and patient is telling whole history, whole long history of 2 hours, and at the end of history we cannot get any symptoms. Why? Because in our mind, if we have fitted something through the repertory, then we can get this is the rubric, this is the rubric, this is the rubric, and from that we can understand. So that is what sir always says, I do not see what mind does not know. In front of you everything is happening, but you cannot understand because there is nothing in the mind. So to feed something into mind, we need to learn repertory. So what sir always says, we must understand repertory, and sir always use complete repertory since the beginning. So complete repertory has some chronology in the chapter wise. As always, Kant has mentioned the process that mind is most important and then the body. So there is a chronology of everything. But why this chronology in this sequence only? Very important. So this is what today's introduction tells us, that we need to learn the complete repertory, and sir always use complete repertory with the meticulous result. So why complete? Because one thing, complete name suggests itself is complete. Okay. So construction. So to understand something, say for example, if we have to understand something, so we need to understand the structure and then the functions. So we have a first year class. If we have to understand the human being, we need to understand the anatomy of the human being. And this is the human frame has a head, 2 upper limb, 2 lower limbs, then the trunks and the pelvis and everything. And then this, now we have understand that this is a structure. And after that structure, we have to understand the functions of particular part. So same way, if we need to learn the repertory, we need to learn the structure of the repertory and then how it functions. So that means function of the repertory. So in the construction of the repertory, we have a repertory, we should understand how and why it is constructed in a particular manner. So Kant has given very important aspect. He is a philosopher and he gives that importance to the mind. Now you cannot see the mind. it is unforeseen or unseen entity, which we called as, Hahnemann has mentioned that emotional organ. Mind is in the organ one of medicine. In one aphorism, Hahnemann has mentioned that the emotional organ, it is a mind, and it is a subtle entity. So in a subtle entity we cannot see, but we have to understand. Okay, so mind, we know that it is the boss and it controls the whole human being. So let us understand a different perspective, that why the mind is more important. So right now we are learning GNM, German New Medicines. So the concept of German New Medicines given by Dr. Hammer from the Germany, he suggested that anything which is happening in the body or in the cell, it is associated with the control system of the brain, which is made out of the 3 embryonic germ layer and controlled by the brain system or nervous system. But it is controlled by the nervous system, but the nervous system gets some impact, and that impact is based on some psychological phenomena or some circumstances. So this is composed of 3 phenomena, that psyche, brain and body. So psyche is the things which affect the brain. Brain is a control system, and the brain is controlling the whole body, so body is suffering. So same way the mind is the controller of the human being. Okay, so we need to understand this process, that mind is coming from the head and brain. Always, mind is coming from the, so it is much of the leader that even nature gives it such importance. When a new one is born, the head comes first and body follow. If it is not so, it is called as a breach. When we have a delivery, okay, so the head comes first and the body follow. So that means control system comes first and then the body follows. If it is not happening in that way, if the lower limbs or buttocks come first and then head comes, then it is called as a breach. So it is a breach in the law. So the law is broken. Okay, and mostly sir always says, if the child born with the breech delivery, it is always syphilitic predominant miasm. Either he is not suffering in the younger age, but in a later age he may suffer with the syphilitic disorders. Okay, sir also says, if a child born with the caesarean section, someone has to cut the abdomen, again cutting something, it is also syphilis. So those child who born with the caesarean section, they may land up with the syphilitic disorders, either in the younger age or in a later part of their life. So this is what predominantly. So same way, the mind is coming from the head and brain. So now we have to understand that thus the mind has gained a pride of place, a high place. Okay. So in our repertory, what was the first chapter? Mind. So mind is unseen controller. The seen controller in the physics, vis-a-vis. See, seen control. Mind is unseen controller, but the seen controller in the physics is balancing system. So what is the balancing system consist of? Our brain has some balancing system. Which part of brain is controlling the balance? Cerebellum. So old brain. Cerebellum is the old brain. So cerebellum is the balance system. If the balance is not in the proper way, what happens? We either swinging, we loses the balance, we be confused. So this is what the second chapter comes into our repertory is what I can. Every construction is a specific criterion. Why it is happened? That is why I am giving you this anatomy. Then we will go to the functionality of understanding rubric. So this is what vertigo. The second chapter is vertigo. Now the controlling center is there, but controlling center is located where? Specifically in the head. So the third chapter is given in the body, which is composed of the brain and the mind. The brain is the anatomical part of the mind, and the mind is the functional part of the brain. So mind is in the first chapter, then the anatomy. So this is what the head contains the brain that houses the mind, and cerebral control the balance system. So after that the head chapter, and then the head pain, third chapter, fourth chapter was the head pain. So affections. So if there is anatomy and then affection. Now if the control system is there, so if we understand the human being is like a computer, okay, and there is a central processing unit, we call it a CPU. So when there is a CPU is a control system, you know, okay. So control system is always developed. So to function that control system, we have something to merge with this. So we have to give some input to control system, then control system interpret that input, and then control system gives output. So we have inputs and we have output. So when there is an input, we call it is a 5 inputs, we call it as a jnanendriya. So the indriya that gives information to the CPU, it called as a jnanendriya. And when the 5 output, when the central processing unit is working properly, and that central processing unit gives external output, and that is acted on the particular part. So this is called as the action part. So when there is an action part from the CPU, it is called karmendriya. So we have a 5 inputs and 5 output along with the control system CPU. So CPU is controlled by mind and head. So this is the control system. Then there is a 5 inputs, 5 outputs. Are you getting me? So now we have, what is the 5 inputs? Jnanendriya. Tell me. This is the control system we have. Mind and head and brain and everything. This is the control system. Now what is the Jnanendriya 5 input? From where we can take inputs? Eyes, ears, nose, mouth, tongue, touch. So these are the 5 inputs. So from there we can take informations. Okay. So what was the most important aspect of that? So we have a senses that is coming into the process. So senses are for the survival of the organism. Why it happens? You know. So when we understand the evolutionary aspect of the unicellular amoeba to the complex development of the human being, so everyone has one law. It is called as law of survival, and Darwin has said survival of the fittest. So in the survival of the fittest, we need a specialized intelligence, and that intelligence is working properly, then we can survive. So for this intelligence, we need a certain input, certain output, and certain processing units. So in that, what was the very important aspect of this? Out of these 5, which is most important? First and foremost things, eye. Why eye is more important? Because if you are blind, you can be stuck somewhere else, you can be stumble, you can fall, you can injure yourself, and you may die. So this is what something that eye is most important. And the function of eye is vision, to see something, so to get informations by the visual imprint. So the first sense is eye and the vision. Then we have a ear. So what is that ear? What is the evolutionary ear? We can hear certain decibels only. You know, we cannot hear every decibels of but the animal or a lower animal, they can hear a distant voice, like a bat. They can hear a distant voice. Why? Because they have a long ear. You know, the ear is like this. All animals have this. We have small ear. So if we find this type of people having a ear is, so that means they want more information from the hearing. That is our genetic perception, you know. So same way ear is most important. And if it is ear, now what is the survival of the ear? Initial days, the danger is here. So most of time they understand that a danger is coming to us. So I have to hear that and I have to be alert. So the ear is for alertness. You know, ear is for alertness. And that is the survival mechanism of these senses. And that is why the hearing. So most of time we can see certain rubric in the hearing, that hearing acute. Hearing the clock distant. You know, we have a certain rubrics. So this is something that their survival is here. You know. So that is very syphilitic in nature, because they are in the threat of danger, and that is why their senses antenna is very high and open. So that is why the hearing is very important. You know, now this is the nose. What was the survival mechanism of the nose? When we understand the evolutionary phase from unicellular to the mammal to the fish, and then the reptile, and then the mammals, and then the apes, then Homo sapiens, and then Homo erectus, and then human being. So initially the nose is like this, very forwarded in the animal. Why? The nose is to sniff. Nose is to take a smell. Okay? Why? See, every animal first they have to eat something, use the mouth, they sniff this something. If it is eatable, then I eat. If it is not, I will not. So this is something that they understand, the mechanism, that if it is eatable, that means if it is a good for me. If it is not good for me, it may be poison. So most of time they have feeling of being stink, feeling of being injured, and that is what the smell is most important. Okay, the function of the nose as a survival is something that they sense the dangers, they sense the suspicious. The nose is for the suspicious. Sniffing is the suspicious that something is going on around me. So most of time we have allergic rhinitis patients, you know. So what you have to find out in allergic rhinitis patient? Something suspicious, something is stinking in the environment, or something is affecting her, because there is a hypersensitivity, and that sensitivity has to be removed. So in the initial stage it is a rhinitis, then there is a watery discharge, and if it is more insecurity, then it is a nasal polyp. If it is a more destructive, then it is a atrophic rhinitis, and finally smell is lost. I am so much so sensitive to the smell, or sniffing something or stinking something in around, so better I don't want to smell it. My body has defended as lost smell. So patient comes to us, sir, mane sugandh nahi aati. Last year we have COVID cases. So in the COVID cases, most of time we have two symptoms comes into the COVID. That is, one is a taste is lost, and second one is a smell is lost. Why? So most of people are get into scared. If I take a wrong breath, if I take a wrong breath, if I take a smell of the corona, if I take a corona in, and that is something called fear of being infectious or contagious epidemic disease. Okay? So that is going to happen. Yes, that is a fear. That is a fear. So most of time fear, and that is the, so that's why body has defended. I will make you better not to smell anything, so your fear gone. And that is the reason body is working in a proper sense. So this is a smell lost. Very important. The same way mouth represent the taste and tongue. And something which we realize is psychotic. Something which we discuss, it is going to what? Vomiting. So again, the mouth is for the something that the morsel goes inside, which is giving you a nutrition. But if we understand this morsel is not good for me, then what my body is trying to? My body is trying to throw out that morsel. And that is what the reason that vomiting. So here the feelings that I might get poison. Fear of being poisoned. And that fear of being poisoned leading to vomiting. So this fear of poison going to higher version to the extent that delusion, she has been poisoned. That means, what was that? So delusion that she has been poisoned, so she started making the spasm of the esophagus, she started making the stricture of the esophagus, she started making vomiting of the stomach, she started making stricture of the pylorus. So this is the perception is body trying to make, and this is blocking. The reaction is vomiting. So patient comes to us, vomiting. So we need to understand what was the perception. Morsel she is not going to take inside. You know, so this is the important. And the last, skin and touch, but it is a least in the human frame. So that why this is given in the last chapter. So we have after mind, then vertigo, then head pain. Then the chapter is eye. The function of the eye is vision. Then another chapter is ear. The function of the hearing. Then the nose. Then the smell. Then the mouth and the taste. Now this is something called as input. Now if something we have eaten, something we have taken, so we have generated something called as a waste material out of it. Nutrition has taken, but some waste material. So this waste material has to be removed. So this is something that nutrition. So nutrition, the control. So sora is to survive and take the nutrition, and that nutrition is food. So to take the food inside, we need have certain organs to help that to get nutrition. So if we put something in the mouth, what we need to do? We need to chew it. So we have a teeth, and then we have to deglute it. So we have a throat. Then we have to go down at the stomach. Then we have an abdomen to digest it. So this is the chapter on GI: teeth, throat, external throat, stomach, and abdomen. It is a part of nutrition. So our nutrition is in, so we can survive. So this is sora, very important. And after that sora, what will happen? If the nutrition has been taken, the rest of material is there. So we need to remove this waste. So we need output. So we have nutrition either by mouth as a food, either by nose as a air, or either by water as something. So we have a three type of the food. It is a solid, it is a liquid, and it is a gaseous. So these three has to be removed in the same manner. Okay. So we have removal of the waste through certain process. We have a organ which is called as excretory organs, and it is called as the output. It is a karmendriya. Okay. Then we have another organ which is called a reproductive system in the form of male and female. Okay. This is a true toxic material, waste product. But this is either a waste or it can be used for the reproduction. You know? So this is a reproductive material. And the third one is what I am speaking right now. It is a voice, it is a outbox. So it is the output. So we have a 5 outputs are there. So excretory organs, so removal of the waste to the stool, it is a solid. Urine is a liquid. Carbon dioxide as a gaseous through aspiration, perspiration through the skin. So this is something which we have 3: excretory, reproductive, and the voice. These are the 5 organ of output. Now what happened? Output exiting the metabolic waste. So we have, see, after abdomen, what is the chapter? Organ. So it is a structure rectum, and the waste material is something called as stool. Again, here the criteria is different, because in an anatomical development, embryological development, bladder, urethra develop first, and then ureter, then the kidney. So in the same, bladder, kidney, prostate, and urethra are the organs, and urine is the output. So these are the sequence of something. We here a solid waste, here the fluid waste. So we have a chapter from throat, teeth, throat, external throat, stomach, abdomen, and then rectum, stool, then bladder, kidney, prostate, urethra, and urine. You know. Now what happens? We have something which is output, but it is not completely the waste. If it is used in a good way, then it is for the reproduction. If it is not used in a good way, then it is a waste product. So the male and the female. So in a male it is a seminal discharge, and in the female it is a menses. So these are the reproductive. Then you have to do voice, or you have to talk, or you have to speak. We have some organ. The organ of the speaking is called the larynx, and the function is voice. So these are the output from the above downward. So importance. And after that, see, we have removed the solid waste, we have removed the liquid waste and the organ. Now we have to remove the gaseous waste. So how the gaseous waste removed? By means of inspirations and expirations. So this process is called as the respiration. Sometimes you have to remove by the reflux mechanism, which we called as a cough. Sometimes you have to block the passage by the cough, so it is the expectorations. And from where this is the organ of the chest. So here the chest. So this is the construction of the repertory. Are you getting me? It is very easy to understand how the repertory is built and made up in this way. Now, the another Karmendriya. This Karmendriya is for the waste excretion. The another Karmendriya is called as extremities. Now we have to extremities, the work through the extremity, we need a connection. So we need a connection from the center to the extremity. So where the connection from the head to tail. So head to tail is made up of the spine, and that is what the back. So it is anatomy. Then the extremity, and then the functions of the extremity. So extremity and pain and everything. So this is what and finally end with the sleep, chill, fever, perspiration, and the last but not least the skin. Okay, and the generals. The final output is. So repertory is constructed in this manner, and that is the reason that we need to understand repertory in a proper sense. So now we start with the certain cases so that we have understood how to use the repertory. So repertory seems to representing the law of cure. So we have a law of cure, na? What is the law of cure? Herring's law of cure. Center to periphery, above downward, within outward, more important to less important order, reversal of the. So if you understand repertory, you can correlate that with the law of cure. Why? Because mind, head, cerebral functions are the base. It is the most important aspect, so it was given priority first. Then the chapter are aligned from the above downward, from mouth to down. Then chapter are from the more important nutrition to the excretion. So nutrition is more important, sora, excretion less. From inside out, so input and output. Chapter aligned from the more important head to the least important, the skin. So repertory itself suggests it is Herring's law, and that is what we are learning today. So to start with the cases, a practical point of view. This is just a little bit introductions of the repertory. The practical point of understanding repertory, we will have another presentations. So proceed. So we will start with we have understood the basic concept of the repertory, the construction of the repertory. Now we have to understand the uses of repertory in the practical way. So I am sharing a few of the acute cases with the use of repertory. Many a time in acute we generally prescribe on the basis of the few keynote symptoms which patient is presenting to us. But how the repertory is very useful in giving the important remedy in front of you when the patient is presenting you certain symptoms. So I am sharing with the few of the acute cases which I have encountered in my clinical practice. So to understand acute, we need to understand one aphorism. So always we need to understand the aphorism number 153. So 153 suggests SSUPS. You know what is the meaning of SSUPS? Singular means a single, striking, it's a strike to everyone, uncommon, which is not common, peculiar, very important, and a strange, which is not normal. So if you found this kind of the symptoms in a patient in an acute cases, then it is very important and you need to find it in the repertory and you need to prescribe. You will get sure result in an acute physiological cases. This is what my clinical experience. So we will go through the aphorism number 153. What is written in aphorism number 153? In the search of the homeopathic specific remedy, that means constitutional simillimum or a specific remedy to particular case, morbid state, that is to say, in a comparison with the collective symptoms of the natural disease with the list of the symptoms of the known medicine. So we have a lot of symptoms. You know, we have discussion today morning that we have a case taking and lot of symptoms. Which symptom has to give important? So we have a lot of symptoms. We have to collective symptoms has to match with the symptoms of the medicine. But which symptom has to be matched? Very important. In order to find among this artificial morbific agent corresponding to the similarity of the disease to be cured. So what is the artificial morbific agent? It is the remedy corresponding to the similarity of the case or disease to be cured. So we have aphorism number 3, knowledge of the disease and then knowledge of the medicine. So if we have the knowledge of the disease and knowledge of the medicine, we have to match it properly, and then, but in matching of these things, we have to understand which is more important. So it is called as evaluation of the symptom. Which symptom has to given value in the case. So in that search of the remedy, the more striking, something which strike you, patient tell you 3 times one symptom or one sentence, and he is telling me, sir, give me belladonna, I am belladonna, but we cannot understand that patient is telling belladonna. You know, this is what the more striking. The symptoms is always strike to you, but you cannot understand unless what I said, I do not see what mind does not know. So more striking, singular, only single symptom, and we thought, अरे सिंगल सिम्टम है कैसे दवाई दूं, दे दूं या नहीं दूं. Singular, very important. Uncommon, which is not common. So uncommon means what? We have symptoms of the disease which is common to the disease, and we have uncommon symptoms to the disease. So that is very important. Say for example, the patient of gallstone. So gallstone has a pain of right upper quadrant, it pain refer to the back and refer to the shoulder. So this is the common symptoms of the gallstone. But if the patient has a jaundice without gallstone and the same symptom, then it is very important. So it is the symptoms of chalidonia. You know? Understand? So this is something that you need to differentiate. Does it is a common symptoms or uncommon symptoms? You know? So same thing has to be very important. And the peculiar. So peculiar in terms of the characteristic, where you find, either you find in the signs or either you find in the symptoms. So what is the sign? Sign is something that you have to observe in the patients which is deviated, and the symptoms is something that the patient has a subjective feeling and patient is telling you that this is what I had or I have. So in the case of the disease are the chiefly and most solely to be kept in the view. Very important aspect of what is the SSUPS. In each and every case you have to probe the SSUPS, and that is what very important. You know. So evaluation of the symptoms is based on more striking, more singular, more uncommon, peculiar characteristic, either you found in the sign or a symptom. Say for example, sign. So patient has a frown disposed to. You can see the face, facial expressions, and most of the time in an acute case, this is a change. It is not prior that, but in an acute state it is there, then it is very important. Directly you cannot take. Okay. Sometimes the sign that a child is putting collar into the mouth, it is a tarantula. You know, a child is putting everything into the mouth, it is sulfur. A child is putting fishes or bad thing into mouth, it is a mercury and veratramol. So these are the signs. We have to observe the things. Say for example, sepia. How sepia sits? Cross-legged in the clinics. So this is the sign. Lilium tick sits cross-legged. Okay. I will share one of the symptoms of sign, that a rubric, that patient comes to you, patient is sitting, patient has a headache, patient is sitting like this and this. So this is the symptoms of the patient. You know, patient is sitting like this and severe headache. So which was the remedy? See why I am telling you, because this gives you a clue of observations. So repertory is practically helping you to prescribe a certain remedy in a particular case. Okay, so find out the rubric. Sit, sitting, knee, elbow, positions, specifically in a headache. The remedy is glonoid. You know, there are two remedies in that rubric. Another one is I think iodine and glonoid. But the headache, so congestive type of severe rushes of blood to head, and the patient is sitting like this. So this is a sign, and this is very PQRS. So if we have this PQRS symptoms, do we need to prescribe? Do we need to ask certain things? No. That is what SSUPS. You know, are you getting me? So this is most solely to be kept in view. You have to kept in view. You have to very vigilant that this is a PQRS symptoms, and that gives you a remedy. Okay. So for this more particular, these are very similar one in the list of the symptoms of the selected medicine must be correspond to in order to consider the most suitable affecting the cure. Okay. Now, what was very important aspect in an acute case? We always know ailment from is more important, and the symptoms are very evident and striking. So, what was the ailment from? So, aphorism number 5 says that exciting cause in an acute case and a chronic fundamental cause in a chronic case. So, most of the time, exciting cause is most important. So, the exciting cause can be either physical, either a change of weather, either environmental, or either emotional, or either a drug or a toxic induce. Okay, so you need to keep in a view how the patient is presenting to you, specifically in acute cases. So ailment from is most important. So for example, I had a case. The case of one boy, one young man, around 30 years old. He came to me with the complaint of diarrhea. And in the morning it was a diarrhea, watery, and then after that it is pain, gripping colic, and followed by bloody diarrhea and severe pain, and that was. So I asked what happened. So he said that I had a pain and everything and bloody diarrhea. So I asked what happened. So he said I used to have a constipation. And I had taken Indrayan. Indrayan is a herb which is used for the relieving a constipation. Okay. So this is something a vegetable substance, Indrayan. So he took Indrayan yesterday night, and today morning he got diarrhea, and after in the evening he had this bloody diarrhea. So he was so much so in panic, and he came to me. Now what is to be cured in this case? This is a very important. We have a cause. We have a symptom. So what is to be important in this case?
Ailment from vegetable medicaments.
Exactly. So we need to prescribe ailment from vegetable medicaments, abuse of vegetable medicaments. So in that rubric we have two remedies, carbovage and naxomica. So it was very fast and acute remedy. Carbovage is a slow remedy. So I prescribed naxomica to the patients, and that patient recovered on the next day. No diarrhea, blood stopped. He had a diarrhea for one day, and it was a watery and then yellowish and then in normal stool. And so we need to remove the toxics. So this is ailment from is very important in the acute cases. If you get, if you don't get, there is another way. You know. So let us see some cases. So what you should observe in acute cases. So in acute cases, you need to observe the changes in the health of the body and of the mind. So previously it was normal, and suddenly what happened? Changes in the body, in the mind. You need to observe these things. What is happening in the level of mind? What is happening at the level of body? Okay. Then this morbid phenomena, that means a change, that is morbid phenomena which can be perceived externally by means of the senses. That means we are, and notice only the deviations. No previous symptoms che patient mat, that should not be noticed. You need to notice the deviations. 2 days back he was absolutely normal, nothing. We are not treating constipations in that acute case. Right now I had to treat the bloody diarrhea. So what deviation is there? The deviation is after taking that vegetable medicament, and that deviation is diarrhea, and that, so I don't have to treat the constitution के लिए और एक दवाई देनी पड़ेगी शायद, but in the acute state what is the only deviation has to, which is formerly healthy. Okay, so this how they represent to us deviation. So deviation is represented to us in the following way: patient fed by himself. So the patient give you subjective symptoms. This deviation is by patient. So fed by patient, they give you subjective symptoms. I had a pain, I had a weakness, I had these symptoms, I had that symptom. These are the subjective symptoms. Okay. Then another way, remark by those around him. So relatives give you symptoms that sir, today morning everything is okay. Suddenly nearby my house one marriage function is going on, so firecracker was blasting, and suddenly my child was shocked, and then after he fell down and he goes into deep sleep. What is that? Ailment from fright. But fright from what? Noise. That is very important. So this is marked by someone else. Patient is not telling you something, but this is marked by the relative. So most of time in acute cases, you can get history from the mother, and that mother give you history like this. Are you getting me? So in that case, what was the remedy? Either aconite or opium. So these are the two remedy which is acting fast. But what was the state? If the person goes into panicity, then it is aconite. It goes into sleepiness, and that is the opium. So that is what the opium has prescribed. So those around by him, marked by those around him. So this is what relatives gives you history. Most of in a hysterical patient, relative gives you history. सर कुछ भी नहीं था, एकदम सडन कुछ हुआ, झगड़ा हुआ, थोड़ी देर बात हुई, गुस्सा हुई, और गुस्सा होने के बाद ऐसा हो गया. That is what something different. Delirium hysterical. So this is something marked by those around. So we have to understand that. And observe by the physician. So sometimes the patient comes to you and the patient gives you certain observation in the clinic also. I will tell you one example. Few days back, one patient came with the complaint that, sir, I had a pain in the back. So she shows me like this, pain in this area, back. This pain is coming to this, from this to this, and from here, and it lasted here. Sir, this is the only pain. यहाँ पे पेन होता है, यहाँ से यहाँ तक पेन आता है, यहाँ तक आता है, और ये साइड नहीं होता है, सिर्फ राइट साइड ही होता है. यहाँ बहुत सारा. And that was the only evident symptoms patient is presenting. This is for 2 to 3 days. So how can you observe this thing? In repertory you have to understand the things, and that has to be used. Okay. So in that case, I took a rubric that pain, back, lumbar region, extending to ischium, inguinal, abdomen and ischium. This was a long rubric, and the remedy is lobelia syphilitica. Okay. Though it is a rare remedy, but this is the SSUPS of that remedy, and that is why we have to prescribe, because it is an acute symptom. It is not a constitutional remedy, but it is something that the acute symptom, the change in the deviations, formerly healthy state, for the 2 to 3 days, then this remedy will help. Okay. Another case where my friend has shared the case, the one old lady came to his clinic, and that lady has a back pain. The back pain starting from this area, upper back, and this pain is traversing this to this, from upper back to lower back, since 4-5 days. And what was the history? I asked the lady what happened. So she said that my daughter-in-law is pregnant, and doctor has advised to rest. So all the household work had to do by myself, and I was so tired and so weakness after that lot of work, and my son is somewhere outside my home. So this is the situation. The old lady having these symptoms, and that is what. So what was that observation? She said that this is the pain, and he prescribed one remedy. After half an hour, the pain went down. Okay. So this is what some symptoms is very important. So in that case, what is the PQR symptom? By observations. So what is the observation? What was this area? This area is called as thoracic. But in the repertory it is not written thoracic, it is written dorsal. So pain, back, dorsal region extending to lumbar region. Okay. Then the patient has a prominent symptoms is concomitant. Since this, there is a weakness. Lot of weakness. She is not able to sit, and so she must have to lie down. And along with that, what happened? So she said ailment. What was that ailment? पहले बहू काम करती थी, अब मुझे उसका काम करना पड़ता है. मतलब what is that? I need to exert more. So it is the physical exertions which gives you pain. So exertion, general, aggravation, physical. Okay. But these three rubrics are taken. Out of these three rubrics, picric acid was prescribed, and within half an hour the pain went. So this is something that observed by physicians. Very PQRS. Are you getting me? So why? In acute, we always know the ailment is most important, and symptoms are very evident and striking. Why symptoms are very evident and striking? Aphorism number 82 says that in the treatment of individualized, as in acute and rapidly developed disease, in acute disease, specifically in acute disease, the chief symptoms, the very PQS chief symptoms the patient is presenting to you strike us and become evident to the senses more quickly. You know, always in an acute, patient gives you PQRS. But it is unless and until our mind knows, then our eye can see that. You know, so that is what the chief symptoms strike us and become evident to the senses more quickly, and hence much less time is requisite for tracing the picture of the disease. You know, so most of time we are confused that acute में कुछ पेशेंट बोल नहीं रहा है, कुछ दे नहीं रहा है, सिम्टम नहीं मिल रहे हैं और हमें दवाई भी नहीं मिल रही है. That is what our newcomers homeopath has the difficulty. What I have faced in my earlier days in acute. Okay, I was so much so failure in acute, but we can now understand organon, and we use this organon in our practice. Then and then we can understand that it is more striking to us. Patient is telling you, sir, give me belladonna, I am belladonna, please give me belladonna. He is begging you, and you thinking of कौन सा दवाई दो इसको, because we don't know belladonna के striking symptoms patient बोल रहा है, you know. So same way, so less time is requisite to tracing the picture and much fewer question to be asked. Patient को question पूछने की भी जरूरत नहीं है, you know, as everything is almost self-evident. Everything is evident. So what we have to do? We have to be so vigilant. We have to make our antenna very alert, and that is what we have to see in the case. So let us see the case. You know, this is the theoretical part. What I am trying to give you importance into this is something that. So let us see case. Now I had a case. Middle-aged man came with the complaint of the pain in the mouth, and showing that there is a small apathy in the mouth below the tongue since 2 days. It is very painful. Do you appreciate somewhere here? Are you appreciating? No. It is something a small here, you know, small, very tiny, and it is a apathy, and he has a pain. Now this is the only complaint, no other complaint he had. Now you have to prescribe the case. Tell me the rubric. Those who have seen that case, don't tell, because I know those who have assisted me in the clinic, they know this case, and they know that result also within 3 days everything is okay. Okay, so tell me how to approach this case. If you have the patient came to you with the complaint, sir, इधर देखो ना, यहाँ पे वो हुआ है, दर्द हो रहा है, that's all. You see that by torch and you दिख तो नहीं रहा है कुछ भी, फिर भी इसको कुछ हो रहा है, and that is what the process is. Yes? Very good, rightly said by the trustee. After small and sore, very important, because very small and painful. So it is a sore, na? And that is what the rubric. Which is the remedy? Okay, which one you prescribe to this patient? Okay, how? Now tell me, that is important. Why not ending that? So 3 mark है तो 3 mark ही देना है ऐसा? नहीं ना? So we have to be so vigilant. Now, if we understand we understand complete repertory in a sequence. But if we understand Boger Boenninghausen, so what Boger Boenninghausen tell us? You have to give importance to a certain criteria. He has given a 7-step hexagon mechanism of the understanding of the symptom. Quiz, quid, ubi, cur, cubus auxilius, cumodo, conda. You know the meaning you can find in the every literature of our repertory. But what was that? So in case of that, you have to, why person is a human being as a whole, he is suffering only one place. So this is important or not? This is important or not? You know? Something very important. See, why location is more important? So we have water. So water is used for the drinking. So are you drinking from some water dispenser? Okay, that is a water dispenser and you can drink. There is a toilet also, where also the water is flowing. Are you drinking from that? Why? Water remains water, it cannot be different. So it is called as the location is most important. You know? Are you understanding? So this whole person is suffering only with this point. It is very important. You know. So every body part tells us something. So Boenninghausen and Boger says importance to the location. Very. He says always you should write symptoms in location, sensation, modality, concomitant. Location, sensation, modality, concomitant. But we forget it. Because we need to search something from the patient. Because we are in the survival mode as a homeopath. So the very important. Now your symptoms is right. Now what was that? Another rubric we read. Very good. That was the very peculiar symptoms of the location, as well as combined with the sensations or the characteristic of the disease, along with the pain, and it is sore and small. So the rubric was taken like this too. The F tongue under and mouth F small and sore. And the only remedy comes is Madorinum. I had prescribed Madorinum 1 in single dose. Asked the patient come after 2-3 days. He came to me after 3 days. Everything is normal. So this is very important. Are you getting me? Again, this different patient. This patient has also came with the same complaint. Middle-aged man came with the complaint of after below the tongue and also on the tip of tongue since 2 days. You know, see, you can appreciate this. Here is there and here is there. You know, like this. Now, एक clue तो मैंने बता दिया. Now how to, no other complaint. That was the only complaint since 2 days and case is closed. Okay. Now you have to view that where to look at and what to look at. So this is what F10 at the tip of tongue. The location is most important. Again same rubric F10 under tongue. Again it is same Madorinum. These 2 patients come same day. You know, the same rubric. F tongue under, F tip of tongue. The remedy is Madorinum 1 in single dose. After 3 days, tongue is clear. You know why? You know, I had given you aphorism number 82. Cheap symptoms always strike to you. What is that striking? That striking is the location. Striking is the sensation. Striking is the pain. And that is the characteristic. And that is the acute symptoms. Or that is the acute deviations of the former healthy state. Are you getting me? Let's have another case. A case of acute viral fever. The fever since yesterday, a small boy came with the complaint. Mother came with the boy. Since yesterday, mild cough, very irritable and cranky since morning. It was treated by mother. Salivation plus plus, or I have to look that child, and that child is not looking at me like this. So evading my look. So that was my observation. First normal stool, yesterday constipation, 2 days stool, today normal stool, morning. Urine normal, yellowish, slight offensive says, aid by mother. So I asked what was happened yesterday, the ailment. So 3 days back, mother and child went to some social functions where child was very irritable and does not like to be with the stranger. Because जो भी आता था उसको बताया तो उसको अच्छा नहीं लगता था. Okay, टच करता था तो उसको अच्छा नहीं. Everyone function try to give love. So पपी कर रहे हैं, उसको खिला रहे हैं, उसको प्यार कर रहे हैं, उसको अच्छा नहीं लगता था. And caressing, but he was not liking that, and he was so irritable at it. He also don't want to go with the people which is there in social function, so he feels not good. What was reactions? So mother has said in the Gujarati, even कोई वाल करे ना तो irritate थी जाए. Even कोई गाल touch करे ना तो इन्हें नहीं जमती. That was so. Even someone has give love and care and caressing, and that child doesn't like. And even someone touched the cheek, that child. See, the small child of I think 1.5 or 2 years, 1.5 years almost. Someone you had seen that case, but they don't like. Okay, I asked mother. So mother says after coming to home at night, he awakes from the sleep and cries suddenly in the midnight after 12:32 a.m. around it, and it happens in 3 days. And that was the situation. Now, what was the things you have to take into consideration in this case? Tell me the rubric. Cares, worries, full of company, aversion to. Very good. Anything else? Those who had seen the case, they don't have to answer because they know the answer. Tell me. See, this was the history, this was the ailment. So in an acute case, we need to find out the ailment, or in an acute case, the change, the reaction, deviation. Na? So deviation has to be changed. So we need to find out the deviations as well as the ailment and combine with this and prescribe. That is the remedy. But it is acute. So what is that happen in this child? Now imagine the child who is suffering from such disease, and if you take them and you give love, does child feel happy or bad? Most of children feel happy. They like to be carried, they like to be cuddled, they like to be caressed, they like to be loved. Okay, but this child is something different. You know, someone is giving cuddling, fondling, he doesn't like. Someone touching, he doesn't like. So this is what something very PQR is reaction to the case. So what was that? Yes, touch aversion to being children is very important. Then we have a 7-8 remedy in that rubric. 11 remedy, yes. So out of 11, which remedy you need to prescribe? Okay. Are you asking me or giving the answer? Yes, I know. The expression is confused. That's why I am telling you. Are you asking me or giving me answer? Okay. See how to unlock this case. You we have a certain symptom. Most of time, this phenomena, this symptoms comes in within 5 minutes of the register taking, and within 5 minutes you need to prescribe. And we are taking lot of time, exerting our mind to analyze the case. Still we are stuck up somewhere. So you need to find out what is PQRS in the case. Mother is very knowledgeable. She gives everything in one stand that this is happening in the child. So what was the first line? Fever since yesterday, mild cough, irritable and cranky since morning. So we need to understand in the acute what was that? Sir has given a wonderful chart. In the chart, sir has said you need to find out the activity at the level of body or mind. It is dull or increased or something else. So what is that? The activity at mind level was increased, but what was the reaction? Irritable and crankiness. So it is a mental restlessness going on. So we need to find out some remedy which is mentally irritable and cranky. One thing. Second thing, what happened? Evading the look. Now this is very important or not? So we have a rubric also. I evading the look of the others. See in the repertory, is there this rubric like this? I evading the look of others. मुझे देखना नहीं है. You know? So can we take this rubric? See, hierarchy of importance we have to understand in the case. Can we take this rubric? Evading the look, because it is a change. Okay, one thing. Then yesterday it was constipation, today normal stool. Can we take general symptoms? Urine yellowish, slight offensive. Can we take general symptoms? Slight offensive. Not so. But what was the ailment? 3 days back, mother and child went to some social functions where the child was very irritated. So very irritated means the irritability is there also, here also. Very important. What happened? Does not like to be with the. So what is that sensitivity? One thing is aversion and one thing is different. What was that different thing? Does not like to be with stranger. See, every line has given importance. Everyone in function tries to give love and caress him, but he was not like that and irritable. What is that? See, indifference to what? Indifference to loved one, so the person become irritated. You know the reaction, indifference may no reactions. Down slanting of the lip or either a flat lip. I don't care about anything. I don't have any difference when you have suffering from. So this is indifference. We have a differentiation of rubric, na? Okay. Does this child is indifferent? No. So do we take this rubric? No. Okay. Remove it from the repertory. Okay. That is very important. Now this is what is it? Reaction. Very PQRS mother tool. Even कोई वाल करे ने तो irritate થઈ જાય. Again અહીંયા શું છે? In every function tried to give love and care as him. He was not liking that and irritable. Yeah, same thing is coming to terms. That means it is even striking and evident. So most of time it is striking and evident to you, but unless and until your mind know, then the rubric comes into mind. Touch aggravations, yes. Here it is written that touch of someone is touching to take cheek. He got didn't like this. So if didn't like, then what was that? Very good. So this is what does not like to be with the stranger means aversion to presence of strangers. You know, very important. And then after coming down midnight, he wakes from the sleeps and cries suddenly in the midnight after 12 to 2 and around it happens in 3 days. So this was something that irritable, cranky nature again comes. Okay. Now we have to understand possible rubric in this case. So first things which is I observe is evading the loop. So in the evading the loop, I took one rubric that think of. It is not the taken a rubric. You have to think like this. So I evade look of others. So this is something. What was the rubric? This is the sensitivity. We have to understand the sensitivity in the case. So someone is looking at me. I have to do like this. This is the reaction. Evading the look of others. So when someone is doing like this, in a constant phenomena, in a change deviations in an acute state, then and then you can take. But child becomes so irritable and cranky. So I didn't take this. Just not a look. So evading the loop, there are different remedies. Either tell me the rubric or tell me the that. I will tell you the remedies. So evading the loop, which are the remedy? Either I think pulsatilla is there. 2-3 remedies are there. It was anger when looked at. So it was a cross reference. So I had already written cross reference anger when looked at. So कोई सामने देखता है तो irritate हो जाता है, गुस्सा हो जाता है. Okay. So something that we have antin-tart, antin-crude, antin-tart, chamomilla, cina, iodine, naxonica, penicilla and silica. Okay. Now a different cross reference to that. अगर कोई देखता है तो मुझे डर लगता है. So reaction is different. You have to observe that thing. So that was the anger. That was the shrinkage, something. That was the fear. So fear at look. कोई उसके सामने देखता है तो उसको डर लगता है. So you can see the fear in the eye of the children. Okay. Another. Fear, observe of her condition being. Fear, observe her condition being. कैसे पता चलेगा? See, I will tell you one case. It was not a case. It was someone has given me situation and I need to give the rubric of that. So in one group, he sent me symptoms like that. He had hair fall and he said that. सर इतना बाल गिरता है, ये बाल भी पीछे चले जाए, शायद मैं टकला हो जाऊंगा तो. So that was the insecurity he had and he said that something that सर सब लोग देखेंगे कि ये बाल चले जा रहे हैं, ये हेडलाइन चली जा रही है तो कैसा लगेगा. So that was the two phenomena happening in the patient's life and patient is telling this situation. Are you getting me? What was the situation? सर बाल चले जा रहे, टकला हो जाऊंगा. Actually it is not a bald person, but he is telling like this. So what was the fear? So first component of this conversation was he said that hair falling is there. So first conversation was he had a hair fall and he said I will go bald. Okay. Hairline is receding. I will go bald. And the second conversation he said that if my uncle, auntie, parents लोग देखेंगे कि ये बाल चले जा रहे तो कैसा लगेगा. So this is the two components. So here in this case there is a two fear are there. So first fear that it is a metaphoric understanding, but just I have given answer to that doctor. The first is that even though he had a hair, but he feels that I might get bald. That means I had something, but I may lose something of a great value. So fear of losing some great value So here is a value, one thing. Second point, I may have something but I will lose in the future. So something which is very valuable and I may lose, that means I may become takla. So takla means poor. Bal means poor. मेरे पास जो है वो चला जाएगा. So fear of poverty, another rubric. So two rubric we have things from the fun situation: fear of losing something valuable or fear of poverty. But he said that कि सर पापा मम्मी ये सब देखेंगे तो कैसा लगेगा. So that means he had the same phenomenon. Fear observed of her condition being. मतलब उसकी ये कंडीशन देख कि वो जो लोग ऑब्जर्व करेंगे उसका डर लग रहा है. Did you get me? So ये बच्चे में वो है, ठीक है. Look at cannot be to be aggravation. Okay? तो कोई देखेगा वो उसको पसंद नहीं है, वो एग्रावेट करता है. One thing. These are the cross reference of evading looks. You know, morose, sulky, looked at when. You know, we have angry. So anger has a component on the face. Morose has a sadness, sullen. These are the different version of morose. You know, morose. So morose means if you want to ask certain question, he is not in the mood to give you answer. That was a morose kind of personality. You know? He has no anger. There is anger, but anger is not expressive. Okay, but like this. So this is evading. So morose, sulky, looked at when. Okay. So evading the look. Another cross reference is like this. Weeping children in looked at when. बच्चे को सामने चालू हो जाएगा. देखा नहीं कि रोना चालू. बाबू बाबू करते तो बाबू रोना चालू. So this is what weeping children looked at when, or weeping looked at when. So these are the big rubric, and then it is a sub rubric is children in. Okay. So these are the rubric. Out of which rubric you have to take in this case? See, we are in the repertory series, so we are thinking in the repertory language. That which is the reactions in the patients we are taking.
Anger looked at.
Anger and looked at. Okay, we can think of this, but it is an emotional. Which are more important in the hierarchy of the symptoms? You know, we have hierarchy of the symptoms. So which is more valuable in the case? So by this line we have thought this rubric. Okay, but by this element we have thought which rubric? Looked at cannot being a, okay. Morose, who will say? Morose, sulky, looked at when. Okay. So let's see. Now, what was the ailment? He don't like to be touched, don't like to be loved, don't like to be fondled. So we have a caress aversion to being. Now we have another rubric, caress ailment from aggravation. Which one needs to be taken into case? So it can be ailment from aggravation or caress aversion to be.
Ailments from aggravation.
Where to take ailments and where to take aversion? Exactly. When the caressing, a good caressing, as I had another situation I will tell you. A small girl, he has an elder brother. So girl was very irritable. When brother came to us, he liked to hugs, he liked to play with, and that girl was not liking. But so that was caress aversion to me. Okay, and here the caress ailment from aggravation. तो जब फंक्शन में गए तो सब लोग उसको कैरेस कर रहे थे again, but the reaction is what? He does not like to be. So the ailment is the emotional aspect and this is the reaction. So reaction is more important or ailment is more important? Reaction is more important because it is more syphilitic. This is just a store of syphilitic. element of careless, but it is a civility. कौन सा बच्चा ऐसा होता है जिसको careless पसंद ना हो? You know, so he has a strong aversion, means a strong dislike. I don't like to be careless, and that is what careless aversion to be. Another cross reference है इसका touch aversion to guilt. तो आ गया वो तो है ही. Then anger caressing from. अभी कोई प्यार कर रहा है तो गुस्सा हो रहा है, तो another cross reference. इसमें भी एक दवाई है, ठीक है. Indifferent apathy caress to. You have this rubric, but what is that? मुझे कोई फर्क नहीं पड़ता प्यार करे कि नहीं करे. I don't care about. Okay, husband आके प्यार करता है पर I don't have any reactions. Indifferent apathy caress to. Okay, then this is the reactions. Again, whited cannot be. Patting and caressing are of no use. जब बच्चा मदर बच्चे को लेते आती है, बच्चा ठीक हो जाएगा, अच्छा हो जाएगा, like to pat and caressing, but child cannot be quiet. No use of that things. Very irritable and cranky child. This is the cross reference. And weeping caressing from. You know, this is a passive one, this is passive one, this is active one. कोई caress करता है तो रोने लगता है. Indifference caress करता है तो indifference हो जाता है. Caress करता है तो गुस्सा आ जाता है. Fine. So these are the passive rubric. These are, so you have to understand these are the emotional rubric. You know, and this is the will rubric. The liking and disliking is the will. So in also rubric also you have to understand which rubric has to be given importance. So here this is very important. The reactions of caress aversion to. So how a 1.5 years young boy child does not like this. So this is a will. Okay. So I took two rubric. Caress aversion to being in presence of strangers, aggravate, rightly said by Dr. Ayushi. So I prescribe Sina. Very easy remedy. But see, the rubric is easy. But why I am telling you, this is a repertory series. So in understanding repertory, we have the horizon of remembering 4 or 5 more rubric to understand. So in what cases, which type of rubric we have to took. You know, evading look में anger at looked at है, touch at looked at है, ठीक है, looked at aggravations है, more sulky at looked at है. So that has to be important. Okay. So in that case, I took this. I prescribed Sina 1 and 3 dose. Child is absolutely fine. Okay. Let me have another case. Same case of Sina, but it is not my case. It is Vijay sir's case. So I am sharing with you because today we are going to learn disposition of the semen. Okay, so the male patient 43 got hemiplegia on right side, was admitted to hospital in ICU. His brother, who was working with the sir, told him that at this 11:30 called is at this 11:30 night in the phone. Sir asked him what happened during this day. Does any quarrel? Does any fight? Does any conflict happening? So no history of the anger, no fright, no grief. He himself could not talk due to paralysis of the tongue. BP was 200 by 120. The family almost all uncles and died because of hypertension and heart attack. This was the history given by the relatives. So he just told me that the doctor wants to start intravenous antihypertensive. So I told them, wait. So I asked him, what you see and observe about his behavior regarding thermal thrust, general, etc. So this was sir's patients. You know why? The history from the relatives, acquaintance, and what he observed. Aphorism number 6. Okay. So what was he said? Only one thing I have noted since last 1 hour, he is asking for something to eat like biscuit. Biscuit खाने की इच्छा हुई है. That was the only things that he is noticed. So sir said that fortunately the doctor was known to sir and had faith in homeopathy. So sir told him, let me try 1 dose of homeopathy, and if he does not improve, then you start your protocol. Okay. Now what was the sir's prescription? Sir has to this rubric. What is the complaint? Hemiplegia, twice again. So the rubric is paralysis, general paraplegia, along with what was the things? PQRS. See, observations, very important. So, how many paralytic patient goes to ask the, I need to eat? But this is what the sir's eye has seen, that things, that this is the hungry people. So he was so hungry during paraplegia, and sir has took this rubric, hunger with, and sir prescribed Sina. Now what happened? This is the follow-up. So prescription is not there, it was just a piece of paper. Sir says write in the piece of paper, kept in her pocket, Sina 200. Within 5 minutes, blood pressure become 180 by 110. After another 10 minutes, BP was 180 by 106. After another 10 minutes, BP was 150 by 100. Patient slept. And the next day morning, the BP was 130/80. So the doctor there in the hospital called the sir, asked how it is possible that without administering any remedy it couldn't be happen. Or he asked another question, is this remedy is antihypertensive? So I can use in another patient also. That might be helping that. Okay. So that was a question to Dr. Propulvijay, and sir laughed. No answer given by the sir. So this is what something that you need to find PQR. See what I said, that everything is self-evident in acute cases. So this was a self-evident symptoms that person, but it is our eye to see that things in the. So let us study some point of Sina. When you know the Sina is children remedy. But did you prescribe Sina in older people? Sir has prescribed. Sir has prescribed in this case, and sir got wonderful result. So how can we understand Sina patient when comes to you in front of you? Tell me, irritability? Always irritable, yes. तो always irritable होता है तो हम लोग नक्सोमी का देते थे ना, क्या करते? हैंडल सीना दिया, सर बड़ा है, बहुत निकले और गुस्से वाला, तब सीना देते, ओके. बट हम क्या करते? So let's study. Person who desire carry but dislike to be handled. उसको कैरिंग चाहिए और उसको कोई हैंडल नहीं कर सकता. नॉन हैंडलिंग पर्सन. बराबर. So the rubric is aversion to be handled. So we have aversion to be handled. कोई अगर उसको हैंडल करने की कोशिश करे तो we have Sina, Cabrotinum, Natrum, Urine, Sapien. These are the very worst remedy in materia medica. They cannot be handled. So any patient you cannot handle, you can think of this remedy. These are the worst patient. Aversion to handle. Again, aversion to interference. अगर उसके काम में किसी ने दखलंदाजी की, खत्म. He will be very angry. He will be very irritable. He goes into violence also. So aversion to interference, we have Barretta, Carp, Calcarea, Phos, Camomilla, Sina, Natrum, Sinicula, Silicia, and sulfur. Aversion to interference, if you take child by the hand, it cries terribly. Say for example, बच्चा कुछ खेल रहा है और माँ ने बोल दिया चल घर चल, हाथ पकड़ के लेना चालू, और बच्चे ने चालू कर दिया टेम्पर टेंट्रम. एवर्जन टू इंटरफेरेंस, मतलब वो खेल रहा था, किसी को उसमें इंटरफेरेंस नहीं करना चाहिए था, किया, I go into violence, temper tantrum. So this is very important. Only remedy is seen. Say for example, कोई बंदा प्रोजेक्ट वर्क कर रहा है, ठीक है, और किसी ने बोल दिया, बॉस ने बोल दिया कि अब ये प्रोजेक्ट नहीं करना है, वो बंदा इतना इरिटेबल हो जाएगा कि बॉस की बात लगा देगा. That is Sina. Cannot be handled. So and aversion to be careless. कोई उसके साथ प्यार से बात करे वो भी पसंद नहीं है, प्यार करे वो भी पसंद नहीं है, टच करे वो भी पसंद नहीं है. So when you find this type of the adult, you can think of the remedy. Okay, let's have another point. So Sina is not only a children remedy. This is what we learned today, new things. Till now we have learned that Sina is the children remedy, but today we learn that Sina is not the children remedy. So think about Sina when you see a childish adult. You know, childish adult. Now when you find out childish behavior, I think Sina is not there in the childish behavior. Yes, in childish behavior, Sina is not there. Okay, but sir has said that when you think of Sina, when a adult becomes childish, means what childish? Adult is behaving like the irritable temper tantrum child. Adult is behaving like the irritable temper tantrum child-like behavior. Then you can think of Sina. Are you getting me? Easy? Okay. There are adults who want to become child again. Another remedy is Sikuta. Why? Sikuta has a feeling that so much so fear, horrible story affect him profoundly. So he said that better I want to remain a child. Better I want to remain a child. I don't want this chaotic thing in front of me. So I goes into again childishness. So again it is a Sikuta is a childish adult. But here the childish adult means the adult who becomes so much so irritable, anger tantrum like a child is Sina. This is the difference in the behavior. Are you getting me? Okay. People with repulsive mood and quarrelsome nature. What was the mood repulsive? Yes, but what was the repulsive? Meaning of repulsive. See, everything has a point. Quarrelsome, we know. Okay, everyone who is quarreling with everybody. Yes, the behavior, that is something that see, repulsive means previously it is good to them and then it is repulsive. Something you do. What is the meaning of repulsive? Find out the meaning of repulsive. Exact meaning of repulsive.
That cause a strong feeling of disgust.
So, yes, possessing the ability to repel, offensive of the mind, that causes something which is detestable, absence, repugnance or repulsive. Okay? So in Gujarati, it is like angamu paida karna ho, kantarajanak or angamtu. That means again like a aversion state. Okay, like a aversion state, disliking state. So the mood is like this, repulsive, and the quarrelsome, angry kind of personality. So when you find a child or adult behaving like the child, mood is repulsive and a quarrelsome, you can think of Sina. The adult who hate company. I don't like company. Even Natram don't like company. So there is a different component that the Natram has feelings, emotions, but they don't want to hurt by others, and even they don't want to hurt others also. That is why Natram don't like company. But in a Sina, they don't like to be touched, they don't like to be looked, they don't like to be caressed. So that is why they don't like company. Okay, the who hate to touch or caress, don't like to be touched, don't like to be caressed. don't like to be approached. Again, arnica is the same remedy, don't like to be approached. Now what is the difference between arnica and sina? The arnica has the feeling, that feeling of being injured. But here it is not like this, don't like to be, so mentally so much so sensitive that they don't like to be approached. Don't like even look at. Even someone look from the distance space, then also he don't like. So that is what approach. Aversion to interference, what I said in the project work, he is doing in a diligent way, but someone is prompting something and then it is going to blast. Aversion, again, interference and interruption, these are the two different things. So we have a rubric, interruptions, aggravation from, we have miserium and barbaris. But it is interference, मतलब जो कर रहा है उसमें कुछ कोई interfere कर रहा है, then it is aggravation. This is the different things, you know. Aversion to be handled, though wants to be carried, and who have increased hunger. This is very important physical symptoms. So we have sulfur, but aversion to everything, then you can think of sin. Okay? Hope you enjoy this, the wonderful series of first lecture of this repertory series. We will have, okay, let's read another case. Let's see. I think I have to end this, but this is okay. Let's see last case. So, fine. So this was the disposition of Sina. Till that we have understood the Sina is a children remedy, but now from this repertory series we understand the Sina can be think of in the adult also. Are you getting me? Okay. So let's have another case. This was an acute case. I think few of you have seen this case and you have seen the miraculous result within 20 minutes, I thought. So this was a case, one lady came and the symptoms like that, since today morning she had a pain and burning, especially in the this hand, right hand and finger and the teeth. So she came to me, इस सुबह से ये हो रहा है, जलन हो रही है और दर्द हो रहा है और numbness हो रहा है, burning feeling हो रही है और I didn't ask any questions. She plainly tells the sensation that એવું લાગે છે ગુજરાતી એવું લાગે છે કે દરવાજાની અંદર આંગળી આવી ગઈ હોય અને કેવો દુખાવો થાય કેવો દુખાવો ફીલ થાય છે. So in Hindi that if ये दरवाजा के अंदर उंगली आ जाती तो कैसा दर्द होता है वैसा दर्द. So if it is in between the door closing and the finger is being pushed in and that type of pain she had. So that was just a self-evident history, and out of that self-evident history, what was the rubric? Those who have seen this case, don't ask, don't tell, okay? Those who have not seen, but you have to understand from this point of view.
Heat burning fingertips.
Okay, very good. What was the remedy? Pyrogen. Okay, you can think of pyrogen. Tell me.
Squeezed as if.
Squeezed
Crushed.
as if, crushed as if. Yes, you had heard this case. That is why you are. Yes, yes. I had a discussion in the camp.
Okay.
That's why. Yes, you heard this rubric. Okay, fine. That's great. Fine. So, the first and foremost thing is location is very important. What I say. So, what was the location? Localization, upper limb, fingertips. This is what the location is. Now, location, sensation, modality and conformity. What was the sensation? Patient says it is a burning, but specifically where? Fingertips. So, this was the another rubric, burning fingertips. What was the sensation? More, this is a general sensation, but more specific sensation she tells that in the door, in between door, my finger is being crushed as if I had a pain. So this is what I took two things. The crushed as if and squeezed as if. So previously I took squeezed and then I took another. So I want to see that which remedy comes in common feeling. And the two feelings, crushed and squeezed, specifically in the teeth. The only remedy comes is causticum. So I prescribed 3 doses of causticum 1 ml in 10 minutes apart. I asked the patient to sit outside the cabin 2 doses of Pasticum was that she came to the consulting room and she said that pain was reducing. Again I prescribed another dose and I asked to report and everything. So this was in acute. It is everything is self-evident. Everything is very easy to understand and everything is in a PQRS. We call it SSUPS. So this is what understanding of this series. Hope you enjoyed the series. We will continue the session on mind with the few rubrics in next sessions. After 15 days, we will conclude this another session on repertory series. So today we end up this series of the first lecture of this series, and we will continue this series again. So we will have a plan up till December 2020, almost February 2023. We have the lecture series on this repertory series, and we will continue the learning of different dispositions through the repertory. Hope you enjoy this and hope this little knowledge will help you in your practice to get the answers of your cases. I am very happy that I am sharing these things with all of you. Thank you all and thank you for patiently listening to me. And thank you online viewers. Most of viewers are requested me to be an online class. I request all of you, please share my channel with all of friends. You subscribe this channel. If I get more thousands of subscribers, then we will make it online for all of you. So, and thank you for all your love you have shared with me, and all your comments are welcome. All you want to learn from me, please share with me. Email me on satyamhomeopathy@gmail.com so I can have little share of my knowledge with you. With the blessings of Praful Vijayakar sir, I am sharing everything because what I learn from sir is nothing but the sir's blessings, and that is what I am sharing all of you. Thank you all and thank you for the wonderful class. Thank you.